Hi everyone, I am MP Harlan or Harlan MP. If you watched my previous video, which was my introductory video, you will know that I am an adult general nurse practitioner that specializes in women's health. And so, pretty much just a quick overview. My channel will be all women's health. I will discuss anatomy, which I'll be discussing today, and I will discuss things of PCOS, fertility, things as fibroids, thyroid disorders, anything kind of underneath the umbrella, which is a fairly big umbrella. So we will be talking about a lot. There's a lot to talk about on this channel when it come in regards to women's health. So just a quick thing, bear with me. My setup is probably very poor. It is very new, so don't go off judging me. As far as positioning and lighting, you are in the growing pains of this channel. So um, Rome wasn't built in a day, and neither will this channel be built in a day. So you're along for the ride. So anyway, so let's get started. Today we are discussing anatomy of the genitals and the breasts. Okay, so this is my friend. This is Yasmin. Yasmin. I like this way better. Yasmin. That's what I'm calling her. That's her name. So this is Yasmin. Say hi to Yasmin, everybody. So this nice crochet model, which I got off of Etsy shop, which I will link in the cards. Oh, look at me. Or I don't know. That may not be the right expression. I don't know. I'll learn as I go, right? So this is Yasmin. So Yasmin was crocheted for me by Etsy shop, and like I said, I will find someone to link her. I will acknowledge her. But anyway, so let's get this started. So if you can imagine your genital area, or if you have a mirror, that's even better. I always recommend women to take a handheld mirror and look at themselves. I mean, how else are you going to learn? I mean, yeah, how else are you going to learn? So anyway, so let's imagine these are your outer lips, right? This brown part, right where I'm touching, where my hands are at. This would be called your labia majora, which is also known as the outer lips, okay? So then we go inward when you essentially spread those lips. And these are the inner lips, the labia minora. See? So they kind of, people call them, there's plenty of slang terms for them, meat curtains, flaps, whatever. But medical terms, what we're going to use here, that is called labia minora. Okay? So a lot of times when I notice when I'm speaking to women, they believe their entitled genital area is called a vagina. That is completely, utterly wrong. And I need you guys to know that. Your entire genital area is not called a vagina. And it irritates me a lot when I hear women say, "Oh, my vagina hurts so bad," blah blah blah, or I don't know. It's just like, "Oh, I can't," or "I can't urinate. Something's wrong with my vagina," and it's just like, you don't urinate out your vagina. Gosh, like, oh, where were you at in anatomy and physiology class? Jesus. So anyway, so I'm gonna use my two fingers, and I'm gonna insert. This is your vagina, the entrance. The entrance. Dildos, fingers, I don't care what you're into. That's not why I'm here. I'm just saying this is your entrance for whatever you're into. Then I'm going to move up, and I'm going to put my finger slightly in right here. This is urethra. So this is strictly an exit. I mean, so it's a vagina, it's an exit. This is the exit, okay? So this is where you urinate from. You do not urinate from your vagina. Do you guys understand me? You do not, I repeat, do not urinate from your vagina. No one does. Well, maybe if you have some type of really awkward medical condition. And no, I'm not getting to that. No, no, you don't. You don't urinate out of your vagina, okay? So you have this opening right here where you urinate from. And that's where your urine come from. It's called a urethra. One teacher told me the best way to remember that is like when you urinate, what do you say? 9 times out of 10, you say So there you go, a urethra. you know. So let's move on up to this fun little ball here, and I do mean fun. It has eight, about maybe more, maybe less, give or take, who knows. It has about 8,000 nerve endings in there. So a lot of females get their stimulations from there, and they orgasm that way from clitoral stimulation. So is your clitoris. Fun little guy, right? And then we're going to move on up. So this top part right here, if you can imagine, um, right below your stomach, I guess you can say. Yeah, not guess you can say. Right below your stomach, there's this area. It's kind of hard, kind of maybe a little squishy. A lot of fatty tissue. It is called mons pubis. That's where it's at. That's that. It doesn't do anything in particular. It just I house organs, of course, but it's nothing fun like this guy. I tell you that. So it's called a mons pubis. So that is the anatomy. Oh, I'm sorry, I forgot. This is the anus. This is the exit, and it can be an entrance for some people. Once again, I don't care what you're into. That's not what I'm here for. I'm just here to discuss anatomy. So, anyways, I'm gonna put my finger in just for demonstration purposes. Yes, that is the anus. So, what I'm seeing a lot of times, women are wiping incorrectly. You're wiping from back to front, bottom to front, however you want to phrase it. It is wrong. Wrong, 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 wrong. I don't care how you flip that. You do not supposed to wipe from back to front. Who taught you that? I literally want to know who taught you to wipe. Like, if you can drop a few comments and let me know, and who the hell taught you guys how to wipe, because it was incorrectly. No, you do not do that. You know what happens when you do that? When you wipe from front, excuse me, from back to front, you bring up all that fecal matter into your vagina, into your urethra. That's what happens. So that's where and that doesn't make Jasmine very happy. Jasmine is not a happy camper when she has fecal matter in places where it's not supposed to be. So a lot of times when I retrieve urine samples from females, it is positive, and the culprit is E. coli, essentially fecal matter. So that lets me know that you guys are wiping improperly. You got 30, 40, 50, 60-year-old people that is wiping incorrectly. And it's very amazing that you guys are abusing Yasmin like this. She doesn't like that. So, okay, so this is essentially the anatomy of what is below your belt. And I believe I covered everything. And it was for, as far as urethra, the reason why it is like a little, I can put my finger in there. It's more so for demonstration purposes. You can't put your finger in your urethra. Like, you can put a catheter in there. No, don't try to do that. Don't try to do that. Don't try to do it. Just being funny here. But seriously, it's an exit. It's definitely an exit. Don't don't do that. Anyways, so that is that for Yasmin. Trust me, Yasmin will be back for more conversations to tell you about her life and how she got here in the world. But anyways, say bye bye to Yasmin. So we're gonna move on to the breasts. Aha, breasts. I don't know what I'm gonna call them. Maybe Bert and Ernie. I don't know. Let's go with Bert and Ernie for right now. Okay, let's go this way. Or this way. I think this way might be a little bit better. I don't know. Like I said, positioning's off, lighting's bad. You just wanted to deal with it. And yeah. So anyway, we're gonna discuss breasts, and I'm gonna go with anatomy real quick. The anatomy is not as cumbersome, I don't know, as you can say with what's below your belt. So obviously, this is your breast. This is your breast tissue up here, and your mammary glands are inside your breast tissue. That is essentially what holds the milk, and I will go into that in another video. But anyway, so right here where I'm touching, that is your areola. Like I said, lighting is poor, so don't come for me. This is your areola, and this is your nipple. There we go. Simple, right? So now we're gonna get off into breast exams. So you will read a few different publications. Some may say 5 to 7, 3 to 5 days after your cycle. Me personally, I always recommend to do a self breast exam 3 to 5 days after your cycle. Please do not go off and do a breast exam during your cycle. You know why? Because our breast tissue are naturally more sensitive during that time. So you could possibly get a false positive, so to speak, thinking like, "Oh my God, something's there," and it's really not. Don't do that to yourself. Don't have a heart attack when you don't need one. Okay. So, anyways, so you take the pads of your index and your middle finger, and you're gonna palpate uh, around your breast tissue. So you feeling for like any types of lumps, any types of masses, any type of excessive tenderness or things like that. And you feel all around. And also you want to go up into your armpit and downside your breast as well, because breast tissue follows in those areas as well. So, and you make your way inward into the nipple, and you lightly squeeze the nipple to make sure there's no nipple discharge. Because the only time we're supposed to have nipple discharge, if we're lactating, I use myself as an example. I am a breastfeeding mother. I breastfeed my youngest daughter, and if someone would squeeze my nipple, guess what? You gonna get a glass of milk, baby, and that's just the way it is. And yeah, you that's it. Also, I would like to say, a lot of times I notice when a woman is taking an SSRI for an antidepressant, sometimes a side effect is nipple discharge. And I believe that is Prozac, what I usually see. I could be wrong, but off my personal memory, like it's somebody else's memory, off my memory, it is Prozac. I could be wrong, but I believe it's Prozac. So, with that being said, kind of for the most part, I order blood work, and I usually order ultrasound or mammogram depending on how the woman is presenting and her history, as far as, did she have lumps in the past that's not related to the Prozac, or family history, as far as like, first degree. I'm talking about mother and um sister and stuff like that, and second, third cousin, that gray areas. But anyways, like first degree family members, those are the people who I really want to hear about. So, and mammograms usually start at about 40 years old. Like I said, there's reasons as to why a mammogram may be ordered early. A lot of times, if a woman, their mother just got diagnosed with breast cancer, it won't kill it. It won't hurt nothing to order a mammogram or ultrasound, especially for family history. And we also going to do blood work as well. So, like I said, you want to do this about 3 to 5 days after your cycle. Some publications do say 7 days, but I always recommend 3 to 5. I definitely would say don't go sooner than 3 days, and don't go beyond 7 days. So you have, a hefty window to get that in. And a lot of people recommend doing them in the shower, or sometimes laying flat on your bed. Like I said, sometimes it depends on what publication she used. But the main part that I need you guys to understand, this needs to be done monthly. You need to get to know your body. Okay? I know a lot of you guys like to have sex, but you don't know shit about your body. And that irritates me. And that's why I'm here, to help undumbify you. And I know that's not a word. I just made it up, so you got to deal with it. So that is what we're doing today. So we're teaching you about your body. So I think that is it for Bert and Ernie. Oh, and also one more thing. So maybe let's call this side Bert. Probably won't remember later. But Bert, he may be a little bit larger than Ernie, give or take. I don't know. Maybe it's a little more fluffy on his side, and sometimes that can be normal. So if one breast have been larger than the other one, if you always been asymmetrical in your entire life, that's not really a big deal, because it's your anatomy. It's your normal. But let's say you just woke up on a random ass Sunday morning and one breast is larger than the other. You may want to pay your GYN a visit in the future, because that's not normal. Or, unless you're a reason why it could be normal is because if you like myself breastfeeding, if one side is bigger than the other, that lets me know that I have to breastfeed. I had to switch sides. And like I said, I will do education on breastfeeding and a few other videos. But, just for the record, if you are breastfeeding and one side is large than the other, you need to rotate sides more. Like I said, that's another conversation. So, like I said, maybe 3 to 5 days definitely after your cycle. Try not to go beyond 7 days. What else about Bert and Ernie? That's pretty much it about breast exams. Do it monthly. Get to know your body. That's pretty much it. They're your friends, and you have to keep them happy. So back to Yasmin. I just want to reiterate. This side's better, I think. This is your bum. Please do not wipe from back to front. Do not do that. I cannot express that enough. I really honestly can't. So you proper way to wipe this way. You wipe from front to back. Front to back. Front to back. Make a little song out of it. Make a little rap out of it. I don't care. Just stop wiping from back to front because, who wants fecal matter in their interests? Who wants fecal matter? Who wants? Who wants it? So, well, this is not an interest. Anyways, so that is pretty much it for my second video, guess you can say. So I plan to upload weekly. Yeah, I plan to upload weekly, if life permits, but that is my goal. Like I said, women's health is my passion, and all jokes aside, I do want to teach women about their bodies and how to better take care of themselves because there's some real dummies out here, and I want to help you not be dumb anymore. Help me help you. So pretty much come to my channel. I'm trying to help grow my channel. You have any suggestions? Any suggestions as far as topics for me and Yasmin to chat about with you guys? I am open to listening. Any ideas as far as positioning and lighting? Because oh baby, this is a hot mess over here. But anyways, we are going to get together one video at a time. So hopefully weekly you'll see me here and listen to my mouth and listen to me to chat. And I have to say this because I hear every YouTuber say this. Don't forget to like and subscribe and drop a comment, share. That is pretty much it. And I am going to leave you guys alone because I know you're probably sick of me.